Hey gang, how's everything going? Got a bit of bad news. I will not be uploading a new video next week. Thanks. Anyway, the reason I won't be doing my usual weekly upload is next week I'll be going in for surgery. It's nothing major. I had a cyst in my leg that burst. I'll be going in to get it drained, but that's the day I do my editing, so I'll be skipping next week. Since medicine is making motions in my mind and it's a major talking point in the media these days, I thought I'd bring up my thoughts on healthcare. Quiet, you. I realize that some of this will be bringing anecdotes to a fact fight, but these are my experiences which have shaped my understanding. Now, I'm Canadian, if you couldn't tell from my outrageous accent. Thanks to Tommy Douglas, we've had a decent healthcare system that even my parents grew up with. As I've mentioned in the past, I had a daughter that we lost. Due to a 22q chromosome error, she was born with, among other things, a congenital heart defect. Her heart didn't form properly in utero, leading to a gap between the chambers of the heart. This meant that old, unoxygenated blood would be pumped through her body along with healthy, oxygen-rich blood. If this sounds vaguely familiar, it's similar to what Jimmy Kimmel's son went through. I'm not really a fan of his, but I have a good understanding of what his family had to deal with. We discovered her issues months before she was born, and, over the years, she visited hospitals many times and had many surgeries, each time getting stronger and stronger. Because the specialists were located at the provincial hospital, we had to drive across the province for these surgeries. Funny story. The hospital where her surgeries took place was the same one that my wife did her postgraduate studies at, and her mother was a nurse there as well, so going there was a homecoming of sorts. Our daughter's death was kind of ironic. She'd gone in for her last surgery a few days after her 13th birthday, which meant she wouldn't have needed another major surgery for years. The surgery itself was a success. Everything had been patched up and her heart looked good. But there was a problem with the anesthetic, which put her in a coma for a month before she finally passed away. The irony is her heart was stronger than ever at that point. She was a fan of dark comedy, so I like to think she would have found that humorous. Her malformed heart was a known condition before she was born, so we never would have been able to get any insurance for her if we had to purchase it ourselves. And there was no way I would have been able to afford the surgeries she needed. I'm fortunate to live in a prosperous nation, and a child should not be punished with ill health because their parents don't make enough. Do I like paying taxes? No, I don't. I don't think anybody actually likes it. But I'm glad to know that what I do pay is going towards helping those that need it. And if we're looking at it from a monetary issue, it's cheaper in the long run to have a government set up for the population because it spreads out the cost over a larger pool. As of 2009, we paid an average of $4,205 per capita, while the US, with its individual insurance companies, it costs about $7,910 per capita. One argument that I've heard against a government-run health system is that it will make people lazy and they won't take care of themselves. Well, this makes sense as a hypothesis. When looking at the real world, it doesn't hold up. Let's compare obesity rates, a leading cause of death, between Canadians and Americans. In the US, people have to pay for their own insurance. So, if the speculation holds, where those who have to pay for it will take better care of themselves, then the population percentage of the obese there should be lower than here, where healthcare is covered by the government. But, if you look at the numbers, we find the opposite is true. The country where people are responsible for their own health coverage has the highest rate of obesity. And, I should know, I fell into that group. In September of 2013, I was hospitalized for a few weeks myself for my own heart condition. It was partially my fault. I was the teensiest bit overweight. Okay, that's a bit more accurate. Once I got out, I vowed to get myself back into shape. Not because it would save the government money if I didn't have to go back in, but because I didn't want to be hospitalized again. I never thought, oh, I can just resume my unhealthy lifestyle and the doctors will take care of me at the next emergency. It didn't matter that I didn't have to pay for it. I didn't want to go through my health being threatened again. So, I made a decision to change my lifestyle. The cost, and who would pay for that cost for another trip to the emergency room, didn't affect my decision in the least. Surprisingly, even if it's paid for, people really don't like to have their health threatened. Is our system perfect? No. Like any system, improvements can be made. But does that mean we should scrap the whole thing? Of course not. For example, one of the major issues here is wait times. As I mentioned, I'm going in for surgery next week on my leg, getting the fluid drained out of it because of the burst cyst. It's been almost a month of uncomfortable pain, where I had to wait to get this done because my life was not in danger. When they thought it could be a deep vein thrombosis, a blood clot that can become dislodged and end up in the heart or lungs, they were prepared to send me to the hospital right away because it could have been life-threatening. Yes, we can make things better, but that doesn't mean the whole system should be torn down to let everyone fend for themselves. Anyway, I'm off next week. I just hope nobody says anything incredibly ignorant that has to wait until I get back. Really? Oh, son of a bitch to grow.